I'm Cindy Rubin. I am founder of In Touch Pediatrics and Lactation, which is a home visit practice in Chicago where I provide home visits for moms and babies during the difficult and challenging, though wonderful transition in the first couple of months after having a baby. And this is the 5 things that I think everyone should know about postpartum depression. Postpartum depression, number one, it's more common than you think. 1 in 7 women suffers from some sort of perinatal mood and anxiety disorder. PMAD is the term that we use in short for perinatal mood and anxiety disorders. And this is becoming very, very common. And probably the number is actually higher than 1 in every 7 because many women don't realize that they're going through it or don't seek help. So, probably you know somebody out there who is suffering from this right now. It is very common. Number two, it can look very different from typical depression. So, depression is often thought of as just a sad mood, maybe withdrawing a little bit and not being as involved in typical activities. In new moms, it can look a little bit different. It can be associated with anxiety, thus the term perinatal mood and anxiety disorders. And oftentimes, women can be very good at hiding it, so can seem to be really on top of things, but deep down they're suffering. And as a pediatrician, I've seen over the years people who come in to see the doctor or call the doctor very frequently with relatively minor concerns about their babies. And clearly, the baby is doing just fine. And that can be a big red flag for a mom who's really just needs help and it's coming out as concerns about her baby, but really it's the mom that needs the help. Number three, postpartum depression and perinatal mood and anxiety disorders are major contributors to the US's very high mortality rate. The United States has a higher rate of maternal mortality than any other developed country. This is horrible. It's not acceptable and it needs to change. Number four, breastfeeding does not cause postpartum depression. I hear a lot people who are talking to people who are depressed, they're having trouble breastfeeding and it's really very overwhelming. Their inability to reach the goals with breastfeeding that they had intended to. And the first instinct for a lot of people is to say, don't do it. It's not worth it. Stop, give formula. And it's not the breastfeeding that causes that depression. It is the inability of reaching one's goals. But the problem is not that there are so many people who can't reach their goals with breastfeeding. It's that the United States does not prioritize breastfeeding and we do not have the appropriate supports in place and easily accessible to moms who need that help. I am a physician providing breastfeeding help, and traditionally, physicians have not received any or very little education on breastfeeding. So when there are problems that require physician involvement, there's no help. And women do stop breastfeeding. And I do agree that there is no amount of milk that is worth a mother's physical or mental health. And so when it gets to a point where it is really affecting that, then I agree that it may be time to switch over to formula or to think of some other sort of plan. But it's not the breastfeeding that causes the depression. It's the lack of support that we need to focus on and improve. And number five, most importantly, you are not alone. There are supports out there. And depending on where you live and your community, it may be tougher to find them, but they are there. And there are national supports put in place via phone to help you find help. And I encourage you to ask for help from your doctor, from your pediatrician, your OB-GYN, your loved ones, whoever you trust. to tell them that you're having some trouble and you need help and you can get it. You're not alone.